Good morning, everyone. My presentation for today is about my landmark article from the year 2014. Before going on to the presentation, there is one slide. There are a lot of factors when you take into consideration of a graft outcome after liver transplantation. As you can see, there is around 5 to 6 factors. Donor side, if you see, there is donor age, donor steatosis. And the recipient side, if you see, there is recipient age, viral status, graft to recipient weight ratio, the recipient MELD, and recent history of any decompensation. All these factors affect graft liver outcome. So when taking into all these factors combination and finding out the outcome is kind of difficult. So this article published in Kyushu University, it was published, it's about some scoring system called DML Scoring System. It's a simplified score. It's just the product of donor age and recipient's MELD. Using this scoring system, you can assess the early graft mortality in living donor liver transplantation. How does the scoring system work? Suppose we have MELD score 20 and the donor is around 40 years old. You get a score of 800, 40 into 20. And if the donor age is 50, the same thing, you get a score of 1000. So going on more into about the study as such, it's a retrospective study. Around 360 cases of live donor liver transplantations were assessed. All the factors that could give an adverse impact on the graft outcome were analyzed using univariate and multivariate analysis, and two important factors were found to significantly affect the outcome: the donor age and MELD score. ROC curve was used to derive the formula. So if you go back, DML score is the product of donor age with MELD of the recipient. You can classify the scoring into three: A, B and C. A less than 450 score, B 450 to 900, C greater than 900. So going on to this classes A, B and C. A, there were about 40% of patients, B had 45 and C had 15%. You can clearly see that A had the best 2-year graft survival, about 95%, and C had the lowest 2-year graft survival, about just 63%. Why was such a bad outcome in class C? It's a known fact already, but probably because of increased MELD score in class C patients, more child C recipients. Surprisingly, a lot of young age recipients were there in class C. We already know this, but it's just more of a subjective fact. But now we have this scoring system to objectively classify and prognosticate. The good things about the study: basically, there's a large volume study. Around 358 living donor liver transplant cases were analyzed. Robust statistical methodology were used. Easy scoring system. This scoring system, you and me, anyone can use. If a patient comes to the OPD, we can just calculate it, and it's very easily usable. The bad about the study: basically, it's a retrospective analysis. It has its own demerits. The scoring system has not been applied prospectively in this study. They've just analyzed the different scores and they've not applied it in any other university as such. More importantly, the quality of the graft and the degree of steatosis was not assessed. A liver biopsy was not done pre-op. So we don't know whether the older age, whether how the graft was, and the younger age, how good the graft was. Clinical implications as for us. Suppose we have a MELD 30 recipient and he has two donors. One son is 30-year-old and his other son is 40-year-old. The 30-year-old has a lower graft to recipient weight ratio, 0.6. The 40-year-old has a better graft to recipient weight ratio, 0.9. We are in a dilemma which one to choose. Most probably we would usually go for the one with the better graft to recipient weight ratio, 0.9. So that would mean 40-year-old. We would ignore this 30-year-old with a lower graft to recipient weight ratio. But the thing is, if you take the DML score, it would be 30 into 30, 900 for this guy. And for this guy, 40-year-old, it would be 40 into 30, 1200. So this donor will come into class B and this donor will come into class C. Class B, the graft survival is about 85%, and class C, the graft survival is about 60% only. So it's more advisable to go for this donor, contrary to what we would usually go for this one. Same thing. If the MELD is lower, if MELD is around 20 and you have the same donors, 30 and 40-year-old, the DML score would be 20 into 30, which would give 600 for this 30-year-old donor, and it would be 840 into 20, 800 for this second donor. In this case, we could as well as go for this one, because both this patient and this one both are the same class B, and graft survival is better, and this one has a better graft to recipient weight ratio also. So yeah, thank you.